Hi, it's Kia, and welcome to an edition of Read With Me Medical. And I will be reading from the CDC website, the Centers of Disease Control and Prevention. And I'm going to read about cyclosporiasis. There has been a recent outbreak in the cabbage and lettuce in Michigan and other parts of the United States. And so I just want to put out some information about what it is. And I am reading from the CDC website. This says about cyclosporiasis. Cyclosporiasis is a gastrointestinal illness caused by the Cyclospora parasite. People can get sick eating food or drinking water contaminated with human poop containing Cyclospora. Overview. Current outbreak. State and federal partners are working together to investigate a multi-state outbreak of cyclosporiasis. Investigations to identify sources of illness are ongoing. Cyclosporiasis is a gastrointestinal illness caused by the microscopic parasite Cyclospora. People can become infected by consuming food or water that contains the parasite. Cyclosporiasis is not usually life-threatening, but it can make some people very sick. Signs and symptoms. People infected with Cyclospora may or may not experience symptoms. Cyclospora infects the small intestine, bowel, and can cause watery and sometimes frequent diarrhea. If not treated, Cyclospora may last from a few days to over a month. Symptoms may seem to go away and then return one or more times, relapse. Timing. The time between becoming infected and becoming sick is usually about 1 week, but can range from 2 days to 2 weeks or more. People at risk. People may be at an increased risk for infection when living or traveling in tropical or subtropical regions of the world where cyclosporiasis is endemic, regularly occurring within an area or region. In the United States, outbreaks of cyclosporiasis have been linked to various types of fresh produce. People can get infected with Cyclospora more than once. How it spreads. Cyclospora spreads when people eat food or drink water that is contaminated with human feces, poop. It takes at least 1 to 2 weeks in the environment outside the body for Cyclospora to become infectious after passing in a bowel movement. Therefore, direct person-to-person transmission is unlikely. Prevention. People can take the following steps to reduce the risk of Cyclospora infection. Follow safe food handling practices to reduce your risk of illness. Diagnosis. Your healthcare provider can diagnose cyclosporiasis by testing a sample of your stool, poop. Laboratory tests can have a hard time detecting Cyclospora, even when patients have symptoms. Patients may have to submit several stool samples on different days to detect Cyclospora. Identification of Cyclospora requires special laboratory tests that are not part of routine stool testing. If your doctor thinks you may have cyclosporiasis, they should specifically request testing for Cyclospora. Treatment. If you are experiencing symptoms of Cyclospora infection, see your healthcare provider. Cyclosporiasis is treated with trimethoprim, sulfamethoxazole, sold as Bactrim, Septra, or Cotrim. If you are allergic to sulfa drugs, talk to your healthcare provider about other potential options. Resting and drinking plenty of fluids is also important for those experiencing diarrhea. Most people with healthy immune systems will eventually recover from cyclosporiasis without treatment. However, if not treated, you may be sick from anywhere from a few days to a month or longer. You may also have symptoms that seem to go away but then return one or more times, relapse. People in poor health or those with a weakened immune system may be at a higher risk for severe or long illness. All right, that's all for the cyclosporiasis about page from the CDC website. Thank you for reading with me, and join me again for more medical diagnosis.